We don't want lockdowns. We don't want mandates. We don't want untested pharmaceutical products that have potential for harm, mandated at a population level. But we now have this beautiful opportunity to think about what we do want. We know what we don't want. What do we want? And so we're coming together to really brainstorm and think about if we could design a healthcare system that serves the people, that gets around the problems of the past, what would it look like and how could we take steps to start creating it?
The World Health Organization's decision-making body called the World Health Assembly will meet next week from May 27th to June the 1st in Geneva, Switzerland, to discuss ratifying global health policies. These unaccountable health masters are expected to vote on amendments to legally binding international health regulations to strengthen future global pandemic response plans. And we know they'll come because the Director General of the WHO, Tedros Ghebreyesus, told us we must prepare for disease X, a placeholder for future global pandemics, as a matter not of if, but when.
There are things that are unknown that may happen. And anything happening is a matter of when, not if. So we need to have a placeholder for that, for the disease we don't know that may come. And that was when we gave the name Disease X.
But the people are fed up, and we don't want to be oppressed by pandemic profiteers fueled by private interests like that of the Bill and Melinda Gates Foundation, who happens to be the second largest donor to the WHO, another private organization. And these people will be taking to the streets at the conclusion of the World Health Assembly's annual meeting to make their voices heard. Joining me now to discuss an initiative called the Geneva Project is Dr. Andrea Nazarenko from South Carolina, who has experience in clinical community and quantitative psychology. She stresses the importance that environmental health plays on the health of the individual.
I believe that the health of individuals and the health of nations are predicted by the environments that we live within. And if we want to create healthier populations, we need to start looking at our environments and protecting our environments so that our children and our future generations are happy and healthy. With all of the stuff that's going on, with the pandemic and all of the things that followed, we're recognizing that just how powerful our environments could be. And when I say environment, I don't just mean the physical, natural environment. I mean our social environment. I mean the systems that surround us, our educational systems, our political and law systems, our workplaces, in addition to the physical environment and toxins in the air and, water and foods and all of these things. It truly is a social ecological environment in which we are residing. And we need to think about those things in order to create healthy individuals. And during the pandemic, we really saw how powerful our environments could be. And when you rid ourselves from these social networks that matter via lockdowns, via masking, which blocked, human expression and expression of emotion, especially, we saw the implications on our mental health. We saw the implications on our physical health. What is at risk right now with the global capture and these ideas that are being put forth either in the pandemic treaty or the IHR amendments, specifically the powers that are being given to global entities that were not elected and do not represent the voice of the people. They are stripping away our national sovereignty, not just politically, because there is, domestic law and domestic constitutions that protect, if you enact them, of course, but culturally. So this is a different slant of the conversation, but it's an important one. This idea of one health, of one world, implicitly strips us from our cultural backgrounds, our cultural heritage. And what that means is that there is an interruption of who we are as individuals. And that is a part of a healthy environment.
The risk to national sovereignty and cultural health heritage posed by global entities is why the Geneva Project will be taking to the streets to brainstorm and create parallel systems that serve the actual health and well-being of the people. Because she says these private interest groups have their own self-interests at heart, not ours.
It is a system that is built on on reward for them. It's built on self-interest, self-gain. Money and financial gain has played a big role in every single thing that they're doing. And so if that's not the future we want, we need to stop making the faulty assumption that they're going to change for us and start recognizing that if we want to create a better tomorrow for our children, if we want to honor this idea of individual sovereignty and this idea of national sovereignty and pass along to future generations the world that was given to us, then we need to accept ownership of creating a world that works for us. We have been taught for decades that we are, maybe even centuries, that we are powerless, that we are the victims. I mean, we heard that all the time. We were the victims to this virus that was getting us, and we needed these big experts to come in and tell us how to live our lives and how to stay safe. But what we saw at the end of the pandemic is that we won. We were not the victims. We were the victors. We weren't powerless. We were very powerful. And we were powerful when we stepped in and united together, when we recognized that the problems were bigger than the division that they were creating for us. And when we united on a global scale, their power could not hold up to it. So the Geneva Project is about that level of unity. It's about the world coming together and saying, yes, of course, we should still fight. But let's take some of our energies and place it into creating a future that serves the people, that represents the voice of the people, and truly creates a better tomorrow that looks different for everybody because we are different. But we could unite together and celebrate those differences. And we are the change because we are the 8 billion.
Dr. Nazarenko outlines how the events will kick off on May the 30th. A summit will then take place on May the 31st, and then a rally and march will follow on Saturday, June the 1st.
So it starts with a people's convoy. It's a we call it a pan-European convoy, but it has grown. We have folks flying in from the United States, from Canada, from Mexico, from India, from Australia, New Zealand, Japan. It truly has become take a plane, train, automobile type convoy, but it's self-organized. There are local groups, a grassroots effort across Europe, and communication points. And these points have really become this beautiful celebration of humanity where people are coming together, strangers that have never met before are connecting together to join in the celebration of all we've accomplished and the future that we hold in front of us. That convergence will land about a half hour outside of Geneva on the 31st. We will simultaneously be hosting a private summit for leaders in the global movement to come together and to have a think tank about the world that we want to create with a focus on the healthcare system. So we know what we don't want. We don't want lockdowns. We don't want mandates. We don't want untested pharmaceutical products that have potential for harm, mandated at a population level. But we now have this beautiful opportunity to think about what we do want. We know what we don't want. What do we want? And so we're coming together to really brainstorm and think about if we could design a healthcare system that serves the people, that gets around the problems of the past, what would it look like and how could we take steps to start creating it? The next day on June 1st, there is a press conference with all international attorneys. This is, the last day of the World Health Assembly week, and the world will be waiting and watching for what the outcomes are. We know that the mainstream media that comes out of their stories is going to be a partial truth at best. And so we will have our international attorneys providing the other side of the story about what actually came out without the censorship or agenda behind the report. And that all culminates in a historic rally. We are the change. It is right outside on the plaza, outside of the UN building, where we will be coming together in excitement, in joy, in radical nonviolence, because we are celebrating the future that we want to create together. We hold the power to create, and we hold the power to create the future that we want to see. So we will be joining together in celebration, and then we will be marching at 4:30 p.m. We'll be marching towards the future with positive intentions and the knowledge that we can create a better world when the 8 billion people unite and decide that it's our world.
Many of the leaders in this global movement that Dr. Nazarenko describes are people who have a track record of making an impact in society. For instance, Dr. Jennifer Hibbard here in Canada, who co-founded the World Council for Health and the Canadian COVID Care Alliance. But there will also be scientists, politicians, and media attendees, of course, and everyday people who care about the future of the world and their communities.
It's truly a diverse group because we're faced with a multidimensional problem. It's very complex, and the solution that we're going to, that's going to get us out of this mess is going to be equally as complex. In relation to how do we change the systems, that's part of the question. It's like in which cases are these established systems functioning and working and just need a tweak or an improvement, and we could, swap out people who work there, like a political system, right? Like, is it just the case where we just need a few more people elected, or is the problem related to private-public partnerships that are ultimately colluded and we can't support any longer? And so it's about really becoming sophisticated and nuanced in the way we approach the problem. And, and not, we are not a group that's seeking this violent upheaval of society. In fact, our domestic governments and the principles upon which they're based are beautiful principles. It's about a return to what we've all collectively agreed. This isn't an upheaval of everything we know. This is a demand that we go back to the principles upon which our country is based and enact that in modern day life.
We are sending a team of rebels to Geneva, Switzerland to be your eyes and ears on the ground to show you just what happens when these globalist health dictators meet and mingle, and by contrast, to report on this global call for freedom by those opposed to the globalist takeover of our health and well-being. To support us in these travel endeavors, please visit exposethewho.com. At that website, you can sign our petition. You can also sign up to our mailing list to make sure that you stay up to date with all of our reports. And if you're able to financially contribute whatever you can to help offset the cost of these travel expenses to bring you this exclusive coverage, then please pitch in whatever you can at exposethewho.com. Thank you in advance for your help.